Welcome back. In the event we didn't meet on your previous visit, let me introduce myself. I'm Dr. Doug Terry, the clinic director here at Terry Chiropractic Health Center. Based on your last visit, we know that you have the 5 components that create the vertebral subluxation complex. For the next few minutes, we are going to cover the important information that will help you better understand your health issues. We will also discuss the most appropriate way to solve these issues. Today we will cover in detail the immediate effects of subluxation, including the reasons for your discomfort or health concern. We will also discuss the long-term consequences to your health if the problem goes uncorrected. Before you were brought back to watch this video, you were given a few pieces of reading material to help you get familiar with your situation. Those pamphlets should be on the table in front of you, and we will now cover specific points contained in each of them. As we review the information, make a mental note of the things that stand out to you. First, look at the pamphlet that covers degeneration. Notice the different phases of degeneration referred to in this pamphlet. Look at the picture of a normal spine, and then look at the picture showing a spine in phase 1, phase 2, and phase 3 degeneration. Now compare these with the 3-dimensional models on the table in front of you. You can see what a normal, healthy spine looks like on the left. Then notice what happens to your spine as it moves through the phases to finally end up in phase 3. For years, it was assumed that the degeneration process was a normal part of aging. However, we now know this simply isn't the case. 40 years ago, the same thing was believed about tooth decay. It was accepted that as you aged, your teeth became unhealthy, decayed, and eventually fell out. If we had tried to find 10 50-year-olds who still had all of their own teeth back then, how long do you think we would have spent looking? If you answered all day, you're absolutely right. Today, it's common to have all of your own teeth at 50 years of age. That's because over the last 40 years, dentistry has proven that our teeth are meant to last a lifetime, providing we take the normal recommended steps to care for them. The bones of your spine are no different. Degeneration and decay do not happen because you get older. Problems occur because of damage to your spine that is not corrected in a timely manner. Just like a cavity that goes unfilled decays until a root canal or extraction is necessary, your spine will continue to decay and degenerate until invasive procedures are required. The great news is that in recent years, huge advancements have been made in understanding how to keep this decaying process from happening. We can even reverse degeneration if the problem is not ignored for too long. Knowing this, it's important to understand the different phases of care, which are explained in the next pamphlet. Notice in the continuum at the bottom of the page, the first phase is called acute intensive care. This type of care covers a period from the time your symptoms start until your symptoms are gone. The second phase is rehabilitative care, which begins when symptoms disappear and continues until your spine is stabilized. These 2 phases of care together are what we call corrective care. The great news is that this process can now generally be accomplished in 4 to 8 months and in as little as 30 to 60 visits in most cases, far outpacing the rate which dental correction can be achieved. It is important to realize that spinal correction is a process that happens over time. You would never expect to have straight teeth after wearing braces for a day or even a month. And you cannot expect to correct years of damage and neglect to your spine and nervous system overnight. So after caring for thousands of patients, it's my experience that 98% of all people who have had chiropractic care in the past have generally experienced care in the acute intensive phase. People often start care when something hurts and only continue treatment until they feel better. To be honest, this is often as much the doctor's fault as it is the patient's, because the doctor failed to explain what happens if the problem is not fully corrected. As a result, time goes by, whether months or years, until the patient is right back where they started. And now they are forced to begin the process all over again. It is important to understand that this cycle of starting and discontinuing care cannot solve the problem, and the process of degeneration and nervous system damage never stops. I often meet with patients who have had years of on and off again care, and their spines are in phase 2 degeneration or worse. And I unfortunately have to explain to them that although they may have received care over the years, they were only getting relief or acute care. As a result, their spines continued to degenerate. There are two main reasons that patients generally only do this initial phase of care. First, health insurance tends to cover only this portion of care, so that's what most doctors treat. Some patients choose to do only what their insurance will cover, but this inevitably leads to further deterioration and far more serious health problems. Since your health is not your insurance company's priority or responsibility, why allow them to set your goals and dictate your decision? That is something that should only be done by you and your doctor, because again, who is responsible for your health and future? You or your insurance company? The second reason most people only undertake this initial phase of care involves doctor training. The vast majority of doctors have not been trained in the second phase of care that accomplishes structural correction. Just as most dentists only have a general practice and leave a dental correction to specialists known as orthodontists, chiropractic also has postgraduate training in specific advanced techniques. This training allows those few offices like Terry Chiropractic Health Center to know how to structurally correct your spine. This is why patients travel from other parts of the world to receive care here. To help you understand why it's so important to maintain a healthy spine throughout life, we've asked you to read the pamphlet that discusses the nerve system. Your brain sends millions of messages down your spinal cord and out over your nerves every moment of every day. These messages have to be delivered without interference to all parts of your body in order for them to function properly. Let me ask you a question. What do you believe happens when those lines of communication between your brain and body develop static or interference caused by poor spinal alignment? If you said that the affected parts of the body function poorly, become sick, and ultimately deteriorate along with your general health, you're absolutely right. Notice the long list of symptoms on this pamphlet. You may see some that you are experiencing. When your spine loses its normal position, it causes pressure on the nervous system and interferes with the messages being sent from your brain to your body, much like a dimmer switch on a light. Your body then begins to function poorly and develops disease. This is why we took time to analyze your nerve system with the most advanced, sensitive, computerized neurological assessment tools available. These scans allow us to pinpoint the areas of your spine and nerve system that are functioning poorly or at a less than optimal level. Once we pinpoint these areas, we can accurately correct the structure of your spine and functional elements of your nervous system. This is ultimately the most important reason to keep your spine healthy. It is this system that dictates the level of health you are currently enjoying, as well as how healthy you will be in the future. When looking at your scans, note any areas of color. These are points of abnormal, unhealthy pressure on your nerve system. It's this pressure that causes organs and systems to function poorly. When you look at your X-rays in just a few minutes, keep in mind that the alignment of your spine dictates how well your nerve system is functioning. This directly impacts your current overall health and your future health picture. Before we review your X-rays, it's important that you have a clear understanding of what your spine should and should not look like. On the X-ray pamphlet, notice there are 4 quadrants. The top left quadrant contains normal X-rays of the spine taken from the side. The spines in the top right quadrant are all phase 1. Those in the bottom left are all phase 2, and finally, the bottom right are all phase 3 degeneration. In the sentence under the top left quadrant, you'll notice it says that a normal healthy spine has first C-shaped curves, symmetrical disc spacing, and no signs of decay. If you look at the pictures of a healthy neck, mid-back, and low back, you'll notice that each of them has a nice, smooth curve. These are all X-rays taken from the side with the individual facing this direction. I want to emphasize how very important that curve is. It's listed first because when this curve is lost, it sets the entire process of nerve system interference and degeneration in motion. This is because your spine is essentially a conduit for the spinal cord and nerves. It is set up like a tripod with a joint on the front and 2 joints on the back. When there are healthy curves, you'll notice that weight is distributed down through these joints in normal ratios. However, notice what happens when the curve is removed or reduced. Do you see how all the weight has now been transferred to the disc on the front? And then notice where all of the decay takes place as the phases of degeneration move forward, right on the front of the spine. Now that you know what this process looks like inside your body, let's take a look at how it looks from the outside. You can see that as the curve is lost, the head moves forward from the shoulders. Gravity then takes over and continues to pull your head further and further out and down. You can see how over time this produces a humpbacked and hunched over appearance. This being the case, what do you think also happens to your nervous system and overall health? Next, notice that in the normal X-rays, all the dark spaces between the bones are relatively equal in size. These are the disc spaces, and they should be equal in size and height. And third, look at what a phase 2 spine looks like on the pamphlet and the model. Do you see how the bones are jagged and rough around the edges? Those jagged and rough edges are what degeneration looks like inside your body. You'll also be seeing views of your spine that aren't on your X-ray pamphlets. These X-rays are views of your spine taken from the front. When looking at these views, the easiest way to understand them is to think of your spine like a stack of blocks. If you were to stack 10 blocks, one on top of the other, how would you stack them to achieve the most stable structure? Obviously, you would want to stack them directly on top of each other. The same concept applies to your spine. When you look at your X-rays taken from the front, you will see a vertical line coming up from the middle of the base of your tailbone. This is your center of gravity. You will then see dots placed on the midpoint of each of the vertebrae. Dots on or very near the vertical line indicate healthy alignment. So now you know what your healthy and unhealthy spines look like. If your spine is in phase 1, the damage can be reversed to normal in most cases. But what would happen if you did not get the corrective care needed to fix the problem? If you answered your health would get worse and your spine would deteriorate into phase 2, you're absolutely right. Notice on the pamphlet that phase 2 degeneration can only be slowed or stopped, but not completely reversed in most cases. The scenario would obviously be the same if your spine was in phase 2 and you did not correct it. It would rapidly progress to phase 3, which is irreversible. In all of these cases, as your spine continues to degenerate, your nerve system is damaged further, causing your health to deteriorate and fail as years pass. After reviewing your X-rays and exam findings since your initial visit, we have identified the structural and nerve system problems responsible for your current health concern. As a result, we now have a clear understanding of how to take your health to a higher level. Our job is to help you achieve your goals. After all, it is ultimately your health. So after analyzing and diagnosing your X-rays and scans, we believe you have options. The first is corrective care, which is certainly what I recommend. It is what I would do if my spine had similar structural problems. But it is a commitment and requires the most participation on your part. It is also what produces the best results. Corrective care means more interactions here in the office, as well as exercises that need to be completed on each visit. We also give you exercises to complete at home on a regular basis. I want to be very clear here. Corrective care requires your participation and effort. The second option is symptom maintenance care, which is designed to get your symptom under control as quickly as possible, and then to maintain those levels. It is not designed to correct the underlying structural and nerve system problems. You'll get relief, but over time, you'll continue to see the spread of degeneration and deterioration. And finally, there's acute care. Some patients just want a quick fix and to come and go as they please. As long as you understand the ramifications of this type of care, I have no problem with that. Ultimately, it's your health, and as I said earlier, my job is to help you achieve your goals. In the next few minutes, consider which of these 3 options will help you achieve your goals. After your X-rays are reviewed, you can let the doctor know which type of care you want and what you would like to accomplish with your health over the next 4 to 8 months. So let's quickly recap the 4 things that you want to pay attention to on your films. This way, when you see your X-rays, you will know beyond a shadow of a doubt what phase you are in and what can be expected if the problem is left uncorrected. First, on the X-rays taken from the front, pay close attention to how straight the spine is. Next, on the X-rays taken from the side, look for the curve. Is there a nice smooth arc, as there should be? If not, what is happening to your nervous system and overall health? Third, study the disc spaces. Are they equal in size and height? And last, do you see any visible signs of degeneration present along the edges of the bones? I hope you found this information helpful. Once again, welcome to Terry Chiropractic Health Center.
Where do I begin? This office has completely changed my life. For the last 25 years, my health had been in a downward spiral. I suffered from migraine headaches, back pain, arthritis. I had numbness in my hands and my feet, and even a really severe digestive issue called IBS. And I had been from one doctor to the next, and all they would do is keep giving me a new drug. And it got to the point where I was taking so many prescriptions, I didn't know what I was taking them all for. There were days where the pain was so bad that I couldn't even leave my house. And some days I would just lay in bed and I couldn't even get out of bed. The last doctor I went to see basically told me that there was nothing that anyone else could do for me and I would just have to learn to live with the pain for the rest of my life. I really had started to give up all hope until one day a friend of mine from church came to check on me, and she told me that I should go to see Terry Chiropractic. And I thought, well, what have I got to lose? And as soon as I walked in this office, I sensed that there was a little something different. I felt that it was special. No other doctor had ever taken the time to really find out the true cause of my problems. And when he went over the Xrays with me, it finally all made sense as to why I was feeling so badly. Since being under care here, I no longer suffer from the migraine headaches. I don't have back pain. I don't have the IBS. In fact, I've been able to exercise and I've even lost 16 pounds. I feel like I'm 30 again. I wish I would have known about this place sooner. But I'm just so thankful for the care that I've received here at Terry Chiropractic, and I know that they'll always be a really important part of my life.
Dr. Doug Terry is one of the best doctors I've ever had the privilege to know. Several years ago, I was blessed to have twin baby boys come into my life, and during their first few years, I experienced severe sleep deprivation and surgery to remove my thyroid gland. My body had always been strong yet easily susceptible to fatigue. I became extremely depleted and suffered for several years as I eagerly searched for answers to my multiple symptoms and to balancing my thyroid and adrenal hormones. My overall health and livelihood were gravely compromised. I saw many doctors who tried to help but weren't successful. Then I started seeing Dr. Terry. I saw him for 3 times a week for over a year for traction and adjustments. His knowledge and passion for natural healing methods were in sync with my beliefs, and together we communicated and researched ways to improve my health. His belief in God and the healing power of the human body were refreshing and empowering. He's introduced me to doctors, supplements, medications, etc. that have been critical to my healing process, yet were never discussed by any other doctors I'd seen before. He's not only been an outstanding chiropractor, but a wealth of holistic knowledge and a loving friend. Thank you, Dr. Terry, and your hardworking staff. You guys are wonderful. Yours truly, Katie Walker.
My first experience with chiropractic care was at the Terry Chiropractic Health Center. It was shortly after my accident, and at the time of the wreck, I was more concerned about the damage to my car and the time I was missing from work waiting for the tow truck driver. But as the weeks went by, my whole body started to stiffen with pain. I could feel it in my neck, my shoulders, and mostly my lower back. After a while, the pain started to shoot down into my legs. I could take almost a whole bottle of extra strength Tylenol through the week, and it would even touch the pain. So I decided to go to my family doctor, and he suggested that I see an orthopedic surgeon. They recommended surgery on 2 herniated discs and pain shots in my neck. I was terrified. I didn't want to get cut open and stuck with needles. Who does? That's when a friend of my wife suggested that I go to Terry Chiropractic. Her family had gone there and had really good results, and I decided to give it a try, and I'm really glad I did. Even after the first visit, the relief from the pain was incredible. Before coming here, I could barely walk without pain, let alone play golf or exercise or even get a good night's sleep. Now, I'm playing the best golf game of my life. I'm back to my regular exercise routine. I even took my wife dancing last week, and all without pain. My favorite part is that the appointments are quick and on time and easy to fit into my schedule. I also got to avoid unnecessary surgery on my neck, and that was really important to me. I would suggest to anybody suffering from pain that their first stop be here at the Terry Chiropractic Health Center, because it's the best decision that I ever made.